Hi, I'm Dr. Clay Sankey, chiropractor and owner here at TruMotion Therapy, and today we're going to be going over the 5 most common myths surrounding back pain. In our clinic, we treat a variety of musculoskeletal conditions, from back pain to TMJ syndrome to plantar fasciitis, but by far the most common that we see is back pain, and my gosh, there are some myths surrounding this condition out there, so I want to shed some light on those myths, and if you're experiencing back pain, hopefully these help you out and maybe clear up some of the grayness that's out there surrounding this complicated topic. The first myth is that hurt equals harm. Just because you're hurting, there must be something that is damaged or wrong in your back, and you need to get an x-ray or an MRI to figure out what that is. Well, sometimes our back just hurts, and there's not a bulging disc or a fracture or something like that that's going on. I like to use the headache analogy. Sometimes, you get a headache, but it doesn't mean you have a brain bleed, right? Sometimes your head just hurts. Well, the same can be true for your back. So maybe your back is just sensitive, maybe you overdid it, and that's what you need to keep in mind. Don't dwell on the fact that, oh boy, I might have a herniated disc or something serious going on. Sometimes backs can just hurt. The second myth is that disc injuries require surgery. So maybe you found out that you actually do have something structurally going on in your back. You've got an MRI and there's a disc herniation. Well, it doesn't automatically mean that you have to have it repaired or surgically repaired. The good news is that our intervertebral discs have the potential to heal, just like every other tissue of the body has the potential to heal. We just need to provide it with the right environment in which to heal. That's where good care from a chiropractor or a good physical therapist can help you out. So not all disc injuries require surgery. In fact, many can just heal on their own. A very small percentage will actually require surgery. The third common myth is that there's something in your back that is out of place and it needs to be put back into place in order to feel better. So the things that are thought to be out of place are the vertebrae. So these little bones in your back, and that, if one is misaligned, maybe it's putting pressure on a nerve and it can cause back pain. And if we just put it right back in the correct position, it will feel better. Well, the problem with that is the spine is a dynamic structure. It's meant to move in many planes of motion. So the mere fact that there is perfect alignment is simply a myth. So in general, nothing in your back is out of place because it's a dynamic structure. It's meant to move and meant to be in different positions, and it doesn't need to be put in place. There are extreme circumstances like a condition called spondylolisthesis where, a vertebrae can shift a significant distance. That can cause some discomfort. Severe cases of scoliosis may do the same. But in general, for the vast majority of people, little misalignments, quote unquote misalignments in the spine, are nothing to worry about. The third myth is that rest will make your back pain better. Now, unfortunately, rest used to be a common prescription for back pain, but throughout the years of research into back pain and research on different treatments, rest may actually be one of the worst things you can do for it. All the clinical guidelines right now recommend physical activity for lower back pain. Whatever you can tolerate is going to be beneficial for your back pain, and typically that thing is going to be steady state cardiovascular exercise. Walking is a fantastic place to start when we're trying to figure out what we can do for back pain. If walking is uncomfortable, try the bike, try the elliptical, try swimming. Whatever you need to do, keep moving. That's going to be the best thing you can do for your back pain. The last myth that we're going to go over is that deadlifting and squatting are bad for your back, that they could hurt your back. Now, you may have had an experience in the gym or know someone who's had an experience where they did hurt their back squatting or deadlifting. And that certainly can happen, but under the proper guidance, under the proper programming, deadlifting and squatting are very good and healthful for your back. They help strengthen the muscles around your spine so we can hopefully prevent cases of back pain in the future. Now, almost any patient of ours who comes in with back pain, we are going to work with them on how to squat properly and how to deadlift properly. They may have no intention to do those movements in the gym ever, but when they're at home, they're going to need to pick up their kids, pick up their laundry, pick up groceries, just grab something off of the floor. Well, those motions require good hinging and squatting patterns, and those are the things that we're going to be working on when we're working on deadlifting and when we're working on squatting. So although you may not be doing those things in the gym, they're really important movements to get good at and feel comfortable doing. So those are our 5 big myths surrounding lower back pain. If you're experiencing back pain, we would be happy to help you. Please visit us online at TruMotionTherapy.com to learn more or to schedule an appointment.